All right, welcome back to the Elias Macko Show. Quebec Solidaire wants the expansion of the private healthcare system to stop. They're calling on the CAQ government to put the brakes on the opening of new private specialized clinics. They say it will harm the public system. Let's find out more. We go to co-spokesperson of Quebec Solidaire, Monsieur Gabriel Nadeau-Dubois, who is on the line. Monsieur Nadeau-Dubois, Gabriel, welcome back to the show.
Thank you so much, Elias.
You're in Montreal this morning. You have power where you are?
I have power. I had trouble getting my kid to the daycare, but it's done, and she's in one piece. So
okay, that
everything's all right.
That is good to hear. Okay, let's. The big issue here that I really want to get to here is healthcare. Okay.
Yep.
What do you think is going wrong in the Quebec healthcare system with privatization? What are you so concerned about?
Well, it's the time of the year where Quebecers are filling their tax reports. And when we're filling their tax report, we realize that we're paying a pretty good amount of taxes in Quebec, a little bit more than in other places in North America. And when we pay those taxes, what we expect in return is to have access to a free and quality healthcare system. The problem is that right now, that deal has been broken. We are paying taxes each year, and in return, when we want to get access to healthcare, more and more Quebecers are forced to turn themselves toward the private sector, and then they have to pay once again to get care. That means that the deal is broken. And the reason why more and more Quebecers have to turn toward the private sector when they need care is because the explosion of the private clinics since the CAQ is in power has led to a draining of the resources from the public system to the private system. That's why the situation is not getting better inside the public system, and that's why the private system is booming in Quebec right now. So I think Quebecers are not getting enough for their money, and that's why we are asking for the minimum to the CAQ, which is to stop delivering new permits to open new specialized private clinics.
Now, I keep hearing from the government, you're not going to use your credit card. You'll use your RAMQ card. Maybe the delivery will come out of the private system, but you won't have to pay for it. And then I hear all these horror stories of people who are forced to pay for it, right? So what's happening here? How is it that these clinics are getting away with charging for things that they shouldn't be able to charge for?
Well, first, there are clinics that are just not respecting the law. Mm-hmm. Second, there are clinics that are unaffiliated with the public system. And what is absolutely incredible is that if you go on Clic Santé, for example, or Rendez-vous Santé Québec, which are official sites of the government, those sites paid by the government will actually direct you sometimes, and even often, toward private services that are sometimes paying, that are asking our clients to pay for healthcare. So that's a huge problem. We should be investing in putting all our efforts inside the public system, but our government is actually fueling the rise of the private system, and the government websites themselves are directing patients toward paying options in terms of healthcare. So it's completely absurd, if you want my opinion.
So does Bill 15 change any of this? Does it actually make things worse on that front?
No, it will not solve the problem. We think it's going to make things worse. We tried during the study of that bill to put forward a modification which would have asked which would have asked Santé Québec to prioritize public options instead of private options, and that amendment was beaten by the CAQ. So what we are scared of is that the rise of Santé Québec will fuel the actual dynamic, which is more and more private and less equity for Quebecers.
We're with Gabriel Nadeau-Dubois, co-spokesperson at Quebec Solidaire. Where do you stand, if you don't have to pay for it with a credit card, if you don't have to pay for it with money, if you're still using your RAMQ card, where do you stand on private delivery of services? And I ask because, there's not just one way of doing universal health care. I don't want to look at the U.S. Everyone gets afraid because of the U.S. It's so crazy. But in Europe, Germany, France, all types of countries, they use the private sector to deliver free health care. Where do you stand on the role of the private sector in delivering health care?
I think we have to look about this with a very pragmatic perspective. The question is, what is the most efficient way to get care to people, and what is the more economic way to give care to people? A recent study showed that the same operation delivered by a private clinic could cost 3 times more than in the public system. So this is a shocking statistic. We have to remember that the private system, by definition, needs to do a profit in order to work. We can love it or hate it, but bottom line, that's the way a business works. And private clinics right now in Quebec, when they charge the government to deliver services, so that's in a case where the patient does not pay for it, they actually charge between 10 and 15% more because they want to have a profit margin of between 10 and 15%. So when we look at it, we are seeing a private system that is supposed to help the public system, but actually costs more than the public, and that drains the resources away from the public system. Let me give you just one more number. When the CAQ came to power in 2018, there were 226 médecins spécialistes, so specialized doctors, working in private clinics. Today, it's more than 900. So the number of doctors working in the private sector has quadrupled in Quebec since the CAQ is in power. And, there is only a limited amount of hours in a day and a limited number of doctors inside Quebec. So each time a doctor works inside the private system, this is a service that is lost for ordinary Quebecers that want to be treated in the public system.
Well, there's no question that the trends are certainly going in one direction in this province. Monsieur Nadeau-Dubois, before I let you go, I just want to bring up one other subject here. And the only reason I bring it up is that it still comes up from our listeners, many of which really like your party, by the way, right? Whenever you come on, I get great comments about you and your party, okay? So let me just ask you this. I still hear from listeners about the tuition hikes for English universities.
Yep.
And you made a career basically. You were at the top of that fight, right? When the Liberals wanted to increase tuition, and on the Anglo University increases, we haven't heard much from you. And so I just want to know what is your position on that, because it certainly seems I would have looked to you to take a big stand on the recent hikes just for Anglo universities and those English-speaking students from outside of Quebec.
The decision of the government to increase the tuition fees inside Anglophone universities, it's a bad decision. It's an unjust decision. Of course, we have to address the issue of the funding of universities in Quebec. And we need a system that is more fair when we talk about funding equally Anglophone and Francophone universities. I think this is something we have to address. But sending the bill to students that are right now in Quebec in Anglophone universities is the bad way to solve that issue. It's an easy way, but a very bad way and an unjust way to solve the issue. We should not be doing this. I've been clear on that. And students right now that are fighting against that increase can count on our support.
All right, we got to leave it there, Monsieur Nadeau-Dubois. Thanks so much for your time this morning.
It's been a pleasure.
Co-spokesperson of Quebec Solidaire, Gabriel Nadeau-Dubois.